Okay, anatomy, physiology. Why we study them together? What are they? Anatomy is a study of the structure. Physiology is a study of function. So while anatomy studies how your organism is structured, physiology deals with how it works. Okay? You may think that, yeah, we know all anatomy. We kind of do know all anatomy, but to give you a perspective, about 3 years ago, there was a major anatomical discovery of lymphatic vessels in the brain. We did not know that it's, such. So people still make some discoveries. Some of them are more of a reclassification, like mesentery was classified as an organ. Physiology is how things work, how your kidneys filter toxins out of the blood, or how your heart pumps the blood all over the body. That's function. These two are inextricably linked. The structure, to a large extent, determines the function and vice versa. So if you think about a function of the heart, for example, just to pump the blood. So pumping is a forceful effort, So if you look at the heart, it's practically a pure muscle. And left side of the heart that pumps the blood into the systemic circulation to all organs of your body has much thicker walls, much more muscular walls than the right side of the heart, which pumps the blood only to the lungs, to the pulmonary circuit, to collect oxygen. So structure is linked to function, and believe me, if structure is altered, for instance, somebody has cardiomyopathy, when, for instance, muscle overgrows or it's dilated and it's like expanded and cannot properly pump the blood well, function is immediately affected. Does that make sense? So we have to always think, this is structured like this. How does it relate to the organ's function? There are different branches of anatomy and physiology. So in anatomy, we will have to address those branches. There's a gross anatomy. Gross anatomy deals with big things. Gross anatomy will say that, this is an arm, okay? Or if you look at, insides of you, they will say, okay, that is large intestine, small intestine, stomach. That's gross anatomy. Not that it's absolutely repulsive, but then you may have microanatomy, anatomical structure, like which cells, how these cells are organized, which tissue is organized. Does that make sense? There are pathological anatomy. What anatomical changes accompany certain diseases. Comparative anatomy, which is completely out of our sort of scope. But let's say we would compare the structure of the cat's skeleton with the structure of the human skeleton. I didn't introduce this gentleman to you. This is Benjamin. And those folks, the muscular folks, they are all Arnolds. Okay? It's a tradition. We have a couple more Benjamins in the prep. Physiology is kind of the same idea. We don't really talk about microphysiology, rather we talk about different levels. So you can have a physiology of a system, like cardiovascular physiology. Or you can narrow it down to the physiology of the organ, or even tissue. And ultimately, you can get to the cellular physiology, which is actually, I prefer to think of as more of a molecular biology, but it depends on how you. There is pathophysiology, how function is affected in a particular pathological condition. There's a comparative physiology comparing, what happens in one species versus what happens in another species, how it relates to the ecological niche or Make sense? So structurally, we're going to focus this too. We're going to talk both about gross anatomy and microanatomy, so which tissues comprise the organ, which cells comprise these tissues and organ. And we, of course, going to start sort of look at physiology of the systems and organs. Okay, organs within the system. So far, so good? Now, one of the foundational concepts that I really want to sort of explain its importance, the concept of homeostasis and the concept of feedbacks. But let's start with the homeostasis. Now, I draw a lot. I compensate for the B in art class in middle school. Okay, so this is a teeter-totter, right? And here, you have a little fella. And here, you have a little fella. Okay? When this fella goes down, what happens to this guy? It goes up, right? And if they are more or less of an equal size, they can do it all day long, right? This. Now, if you look on average, they are in the equilibrium on average, right? But at any given moment, one can be up and another one can be down. So they are in the dynamic equilibrium. That makes sense. This is homeostasis. It's the maintenance of dynamic equilibrium in the human body. And this introduces like two important terms. Internal environment and external environment. An external environment is this. An internal environment, everything that's inside. But here's the thing. It starts going down, but when you walked in here, it was 77. Pretty hot. So you started to sweat. Change in the external environment promulgates change in your internal environment. You respond to it by sweating, right? Sweating, let's say it's not 77, it's 97. So sweat profusely, you lose water, your internal environment changes, you become dehydrated, okay? So how do you respond to it? You feel thirst, you compensate. Or you start peeing less, okay? And you compensate for that water loss by excreting less water. Does that make sense? So this is that teeter-totter. And that brings us to two key concepts of a feedback. So the feedback is a logical feedback. And I want to kind of knock it in you. It's the dynamic equilibrium. It's not static. Your temperature is not 37 degrees Celsius all the time. It fluctuates. Feedback that regulates systems and organs can be negative and positive. So what's the difference? Negative feedback can briefly describe like this. You have a stimulus. No, not the stimulus. No. Let's do different. Change. You have a change. Okay? You have a change. That change leads to some kind of a response. And that response essentially cancels the change. Does that make sense to you? Good? So a good example would be, well, response to the elevated temperature, increased temperature. Temperature goes up, you start heating up, you start sweating, you cool yourself down. It's cold, you start shivering, you produce heat by muscle contraction, you heat yourself up. Make sense? Now, of course, in this arrow, I hide a lot of intermediate steps. Change it. How do you know that it's hot? You have thermoreceptors in the skin, right? How does your body know how to formulate response? The thermoreceptors in the skin communicate to hypothalamus in your brain. Hypothalamus formulates the response, sends the signals to your sweat glands, so you can start sweating and you cool yourself down. So here you have receptors and you have integration center. Here you have effectors. And I will try, with every example of negative feedback, I will try to explain what is a sensor, what is the integration center, what is the effector. Make sense? Overwhelming majority of physiological systems is regulated by negative feedback. Basically, negative feedback is good. It's normal. This is how your body maintains homeostasis. Negative feedback maintains homeostasis. How about positive feedback? As you can imagine, the situation is going to be different. It's going to change. Again, I'm going to hide sensor, integration center, and effector. I'm going to only put response. And then change is amplified. Does that make sense? Good? So I'm going to give you some examples. Example number one, which is bad, a blood loss. In case of extreme blood loss, the blood volume decreases, which automatically decreases blood pressure, and amount of blood that reaches your cardiac muscle, your heart. So your heart does not receive sufficient nutrients and oxygen. And without nutrients and oxygen, it doesn't pump as well as it's supposed to. Since it doesn't pump, your blood pressure drops even more, which further decreases your cardiac supply, which further decreases your cardiac efficiency, which further decreases your blood pressure. Does that make sense? And you're done. This is called hypovolemic shock. Okay? Now, a couple of examples of good things. First, and basically, positive feedback, inevitably, ends up in some kind of catastrophic change, cataclysmic change. Okay? One example of sort of good one, labor and delivery. When head of a fetus, during the delivery, during the labor, pushes onto the cervix of the uterus, that stretch of the cervix sends the signal to the hypothalamus, to the pituitary gland, which releases oxytocin in the blood. Oxytocin makes contractions stronger, which further pushes baby out, which further stretches the cervix, which sends more signals, which means more oxytocin, more powerful contractions, like avalanche, and resulted pretty cataclysmic. You have a birth. Does that make sense? Another example of positive feedback that is absolutely physiological is the ovulation process in a female ovarian cycle. The two hormones stimulate each other, which leads to ovulation. It's a very short period, but that's another example of positive. Other than that, I am not aware of any example of positive feedback which is good for the body. Why I'm so passionate about negative feedback? I teach AP2 on Tuesdays and Thursdays. And from the very first class, it's all an endocrine system. It's all about negative feedback. It's all about negative feedback. To a large extent, what we do here will lay groundwork for our next class. Make sense? We really do. There are certain concepts that you will just take with you and run with it in AP2. And depending on how you know it, you will struggle with AP2 or it will be just a walk in the park. Seriously, I saw both. So when I know what I'm talking about. We're good with positive, negative feedback? Organ systems. I usually do a sort of a fun challenge, trying not to forget any. So we start with the most obvious, the protective one, skin or integuments, protection, physical barrier, basically, regulation of body temperature. Interesting when I can ask you how skin helps people to replicate. How do we choose a partner? In some point by the external features, right? And skin is the part of external feature. So skin in some case, sort of, it is indirectly plays a role in the human reproduction. Muscles and skeleton movement, muscle system mostly movement. Also, it generates heat. Okay, skeletal system support first and foremost. Invaluable storage of minerals, and it produces blood, hemopoiesis. Okay. Support, protection. Okay, respiratory cardiovascular. We're gonna, look at them together. So respiratory takes air in, exhales air out, and cardiovascular picks it up and distributes it around the body. Okay, so cardiovascular system in the pulmonary circuit takes oxygen from the lungs by the blood, and then in the systemic circuit it distributes that oxygen all around the body and takes away the trash, the CO2. And also cardiovascular also distributes the nutrients from digestive system, which function is mostly to digest, also to protect you from whatever crap you eat. Okay. By the way, one function of respiratory gut, it's not trivial, but it's really important. It's a regulation of blood pH. How acidic, you're familiar with the concept of pH? How acidic or basic your blood is. And this is how CO2 is basically acid. You with me? So when somebody has acidosis, too much acid in the blood, these people start to breathe faster. Make sense? To exhale it. Now, if people cannot breathe normally, cannot exhale enough CO2, CO2 starts to accumulate in the blood, which leads to acidosis. And second system that mostly controls your blood composition is renal system. It excretes wastes, unnecessary solids, a lot of toxins, drugs, blah, blah, blah. But it also maintains pH of the blood. Are you following me so far? I'm actually driving to some point. So now imagine I have a patient with a respiratory virus that has a severe shortness of breath and can barely breathe on their own. Okay? Which means even if you give that patient oxygen, they cannot properly exhale CO2. So CO2 starts to accumulate in the blood, and now the majority of load to remove that CO2 falls on the renal system, on your kidneys. Now imagine this is the hypertensive 75-year-old male who already has a problem with kidneys because he's hypertensive. And he's already not failing, but not so great kidneys, have to deal with all that acid. This person goes into the renal failure, and yes, I just described one of the most common causes of death in elderly patients with coronavirus infection. Renal failure. Okay? So kidneys deal with basically filtering out all the crap, also maintain your water balance, which is electrolyte balance. Like they prevent you from completely drying out. So, oh yeah, well, reproductive function is the only one, reproduction. I forgot the most kind of important thing: nervous system and endocrine system. Endocrine is my favorite. So, both of them deal with the regulation of bodily functions. But endocrine system regulates bodily functions by hormones, and you cannot control it. Does that make sense? Well, no, you can't. So like if your thyroid gland produces thyroid hormone, you cannot stop it. Like it's going to produce it whether you want it or not. All right? And so endocrine system regulates your physiology. And it cannot be controlled. Nervous system is a little bit different. It allows you to communicate with the entire world. It receives the signals, processes them, and then produces the response. Endocrine system does the same. It receives signals, processes them, and produces the response. But the processing is more visceral, sort of, you don't even know that what's going on. With nervous, you do. You step on the nail, it's sharp, you lift your leg. That's your stimulus, processing, response. That makes sense. Nervous system does not have to be conscious. Okay? When you get stressed and your sympathetic system gets activated and your heart rate goes up, blood pressure goes up, that's the response you cannot control. What's going to happen? Make sense, right? But to a large extent, nervous system, you can appreciate. Good? I think I got them all covered. Yeah, I think so. Yeah, it's pretty good. Yeah, it looks like it. Okay. With that said, we're going to quickly talk about anatomical terminology. Okay? And I will try an unimaginable thing. I will try to picture a human. Believe me, it's going to look like hell. Not bad, actually, for me. So, I'm going to go over planes and anatomical terminology because it usually presents the biggest challenge. And then I'll explain what you need to know in terms of anatomical terminology, like which terms. Deal? So here's the thing. There are three main anatomical planes. One is mid-sagittal. Okay? That separates human into left and right. Technically, if these are eyes, okay, that's front, then that's going to be left side. And then I promise I'm not going to ask these two terms. It's sinister and dexter. Sinister is left, dexter is right. Okay. Now, what are the directional terms? Directional terms for mid-sagittal. There are several pairs. One is medial and lateral. Closer to the center line, farther from the center line. Now, you can't say eyes are medial or ears are lateral. You have to say to which. So what is closer to your center line? Eyes or ears? Eyes. So eyes are medial to your ears. Does that make sense? What's closer to the center line? Hips or your belly button? belly button. It's essentially on the center line. So your hips are lateral to the belly button. That makes sense here? Good, awesome. Another sort of terms that we can use here is one term, intermediate. Intermediate means in between. Got it? So for instance, your belly button is intermediate to your hips. Can you describe the relationships in more than one word? Yeah, you can say that your belly button is medial to your hips or it's intermediate. And contra or ipsilateral. So contralateral on the same side, ipsilateral on different sides. So your arms are contralateral. Your right limbs are ipsilateral. That makes sense? Good? Okay. Next plane is transverse. So transverse terms associated with it are superior, inferior, or cranial caudal. So cranial means closer to the head, caudal means closer to the tail. Superior means above, inferior means below. They kind of interchangeable, you know? So think of it this way. My chest is obviously above my abdomen, right? So my chest is superior to my abdomen. And I can say that it's cranial to my abdomen. These pair, I don't really use it. So it's mostly FYI in terms of like examples. We're good? And then the third plane, it's called coronal plane or frontal plane. So coronal, and I want you to appreciate that. You see the transverse plane? You see where I positioned it? It's in the belly. But I could position it in the chest or in the neck, right? So, however, there is only one mid-sagittal plane. Transverse planes, there are as many as you want. Like you cutting a stick of salad. Coronal or frontal, same story. It separates human body into the anterior and posterior aspects. And you can run this coronal planes like this, or this, or this, you know, any depth. Anterior, posterior, or absolutely synonymous. Ventral or dorsal. Okay? Good? So, for instance, you look at your okay, let's say your sternum to your vertebral column. Your sternum is what to your vertebral column? Is it in front? Then it's anterior or ventral. That makes sense? Or buttocks to genitals. Buttocks are in the back, genitals are in the front. So buttocks are dorsal to genitals. That makes sense? Okay. Now you may find the term oblique lane, which is any plane that goes at any end. There's no anatomical terminology associated with it. And then there are a couple of terms, directional terms, that are not associated with the planes. One is deep superficial, closer to the surface, farther from the surface. So deep, for instance, your muscles are deep to the skin. Your skin is the most superficial structure in your body. And you can use this terminology even with individual organs. You can look at your stomach and say that, mucosal layer, which is in the very, very deep. Mucosal layer is deep to muscular layer of the stomach. Does that make sense? And vice versa. Now another term is proximal distal. Now we're going to use this term for now in relation to body regions, which we will discuss in a minute. Proximal and distal refers to closer and farther. Does that make sense? Now, we use this term only for limbs. Like right now, we're going to be using it only for limbs. Remember, we have 4. 2 legs, 2 arms. This is not a limb. So proximal means closer to the trunk attachment. Distal means farther from the trunk attachment. Your palms are distal to your elbow. Make sense? Go ahead. Good. Speak up because the mask muffles it. The deeper, closer to the surface, farther from the surface? This is only deep superficial relationship. With this? Nope. So basically, if you say that ribs are superficial to the heart, the only thing that it tells you is that ribs are closer to the body surface than the heart is. Does that make sense? It doesn't relate to any other positions. Did that make sense here? Okay, good. So proximal distal, as I mentioned, palms are distal to the elbow, or knee is proximal to your foot. Make sense? Now, I'm going to kind of take a pause here. So this is how we're going to use proximal distal. But while covering other organ systems, you can find the terminology, something like, for instance, human urethra. There are terms proximal urethra and distal urethra. So in this case, the consensus is that we measure everything in relation to urethral orifice, the opening of urethra. So urethra that's very close to its opening is proximal. One that's farther is distal. Does that make sense? On that end, usually it's closer to the opening. And in digestive system, the opening, well, we have 2, right? It's a mouth and it's anus. But for instance, for a really long organ, which is intestine, say we talk about small intestine, part that is closer to the mouth will be proximal small intestine, and farther from the mouth, distal small intestine. There is a consensus. It doesn't follow any uniform logic. It has its own logic in every case, but it's not our concern here because we aren't chatting about this organs just yet. So far, any questions? Okay. Let's move on. And yes, we're gonna do a break about 10-15 minutes. I will not keep you like prisoners for 4 hours, 3 hours. In the lecture notes, there is a gentleman with a whole bunch of anatomical regions, right? And in the study guide, almost study guide packet, there is a same gentleman with the list of anatomical regions under him. Okay, I have everything closed, so I cannot even show it. Are you with me so far? So the obvious question, what do you need to know? My principle with lists and exams, I always tell you, like everything that's in the study guide, I can answer. Anything that's out of the study guide, I have no right to ask you because I didn't warn you. Right? Yes. No. I just said don't buy it because the actual paper copy, it's only good as a weapon. It weighs like 6 pounds, it can kill a person. Other than that, online, look, I don't ask anything from you. Nothing, zero. I guarantee that everything that you need to know for the exam is in the PowerPoint, in your notes, in my reviews, in the study guide. Like for anatomy portion, for first anatomy exam. Does anyone have a printed study guide here? Thank you. Can you find the dude with the list of, just show it to everybody. No, that's a lecture notes. No, that's fine. So it's okay. You're looking at syllabus, you're looking at lecture, it's okay. So in the study guide, there's a picture of a dude, unlabeled, okay? Unlabeled, with the list of regions. Those are the regions that you need to know. Will I ask you something out of that list? I will not. Am I clear? That's the only regions that you need to know. But I reserve the right to ask any of these regions, to identify like what I'm pointing. What is this? Frontal region. Is that on the list? Yes. What is this? Abdominal region. Is it on the list? Yes. I don't think it's not on the list. I really cannot come up with some, you know. Did I make more or less sense here? Okay. So yeah, when you study, the approach to studying anatomical regions like frontal, occipital, mental, nasal, ocular or orbital, auricular or otic, cervical, thoracic, pectoral, mammary, abdominal, pelvic, inguinal, gluteal, vertebral, lumbar, femoral, antebrachial, brachial, cubital, carpal, palmar. Don't try to study all of them. Say to yourself, I'm going to study a leg, and I'm going to know a leg now. And you go, okay, femoral, patellar popliteal, crural sural, tarsal, calcaneal, blah, blah, blah. You do it over and over several times, you'll label. That's the key. And then you switch to a head. In this case, you will distribute your time better because if you start from the head, you know head perfectly, then you get tired, and by the time you get to the legs, you do not understand anything. Like you just cannot. So take it piece by piece, okay? That makes sense. I'm not going to go over this already. Look, wasting time. A few things that I want to explain in relation to the body cavities, really kind of quickly. So we have two. It's kind of confusing because we always say the term cavity. So we have ventral cavity and a dorsal cavity. Ventral cavity includes thoracic cavity and abdominal cavity. You follow me? Abdominopelvic cavity. Abdominopelvic cavity is further divided into abdominal cavity and pelvic cavity. Thoracic is divided into left pleural, that's lung, right pleural, that's another one, pericardial cavity, and mediastinal cavity. And it's all cavities. Okay? Dorsal cavity is cranial cavity and vertebral cavity. So what do you need to know? You need to have a general idea what's where. Nothing tricky. Look. Brain, cranial, right? Lungs, pleural. Heart, pericardial. Names are telling you the answer. Abdominal and pelvic, slightly trickier. You can think of it this way, by exclusion. Pelvic, all reproductive organs, bladder, and a tad of colon and the rectum. Abdominal, virtually everything else. Stomach, spleen, liver, small intestine, pancreas, most of the large intestine. Okay? Got it? So, have an appreciation. Another thing that memorization questions, I try to get through them as fast as I can because you don't need, you need your own motivation in it. In abdomen, there are quadrants and regions that I want you to know. 4 quadrants. Learning them is like taking candy from a baby. So it's right superior, right inferior, left inferior. Those are abdominal pelvic quadrants. Regions, there are 9 of them. There's umbilical region, there is epigastric and hypogastric. Okay? It's a bit misleading, but so epi above the stoma. Hypogastric is below, way below the stoma. And then on the sides, you have hypochondriac, right and left. Hypochondriac means under the ribs. Okay? Lumbar, right and left. And inguinal, right and left. Sometimes these are called iliac. Okay? That makes sense. Why I pay so much attention to anatomical terminology? This is the language of medicine. Go to nursing, especially nursing. That's the language that doctors are going to use. Especially surgeons. Okay? Even not surgeons. For instance, you have a patient with acute pain in right abdominal pelvic, right superior abdominal pelvic region, right upper abdominal pelvic region. So, yeah, that's pretty large. Liver maybe, gallbladder, and then you read that it's acute pain in the right hypochondriac region. You think, that definitely points in gallbladder. That cholecystitis. Okay, or pain in epigastric region. That points to the stomach, maybe an ulcer. Right? So this terminology gives you location where something happens. Okay? Or wound in, anterior aspect of the proximal brachial region. It's right here. Instead of saying, oh, there's a wound on his arm, that narrows down pretty closely. Does that make sense? So this is why I know it, learn it. It's easy. You can memorize it. Okay? And before the break, I want to quickly go over the body membranes. Because one set of membranes requires a bit of explanation. Cutaneous. That's skin, period. That's it, done. Mucous membranes. Mucous membranes are exposed to outside. I know that skin is exposed to outside, it's just different. This is cutaneous membrane. We good so far? Make sense? Now, what does that mean? Well, obviously, what is exposed to outside apart from the skin? Any idea? Come on. Let's make it chat. Even though your masks are on. Say it out loud. Huh? Perfect. Mucous membrane. What else? Huh? Nose. Perfect. What about your mouth? What about reproductive organs? Yeah. Now, but trickier. What about your intestines? Huh. Where do you get the food? From outside. So you have a giant hole that comes through your body from mouth to anus. The whole surface is essentially exposed to whatever you put in there. It's all mucous membrane. Respiratory system, it's all mucous membrane. Okay, does that make sense? Even the urinary bladder inside, there's mucosa in urinary bladder. Because you can access from outside. Not easy, but you can. Does that make sense? Now, the kind of a tricky membrane is, and yeah, the big difference is that mucous membranes, they are covered in mucus, and you well know mucus is kind of viscousy substance. The point is to trap all this stuff that is not supposed to go anywhere. That's why it's viscous. Now, serous membranes, they covered in a watery substance, so-called serous secretion. Serous membranes cover internal organs. Okay? Again, not all of them, some of them. They cover internal organs. There's a good chance of rubbing against something. So think about all the organs in your abdomen. They're constantly moving, like you're running. They're not screwed in something. They are moving, and to prevent them from damaging each other, they're covered in that serous watery secretion. Now, 3 specific serous membranes that I want to mention are pericardium, pleura, and peripheral. So pericardium is about the heart. I deliberately not saying covers, we'll see. About the heart. Pleura is about both lungs. The peritoneum is about majority of abdominal walls. Now, you have an explanation in this PowerPoint how it works, but I really wanted to draw it. So I'm going to kill cutaneous and mucous membranes here. And I'm going to draw this. So imagine, and this is absolutely like schematics. This is an organ. Whatever it is, a heart or a lung, doesn't matter. Organ, okay? This organ sits inside the cavity. Okay? There is a space, but this organ potentially can rub against the cavity wall. That make sense? So, how do you prevent it? You want to cover, well, I have to, you have to cover both the cavity walls and the organ walls with the membrane, the serous membrane. So here's your serous membrane that covers the organ. And yeah, sorry for imperfect line, but that's the best I can do. Okay, got it? And here is the serous membrane that covers the cavity. See, they're not yet completed, because here's what happens. You see, this is essentially one membrane, like that illustration in the notes. in the PowerPoint that show a balloon and somebody is sticking a fist in the balloon. So if we will try to make an analogy of this picture with a balloon and the fist, this is the fist and the membrane is the balloon. Is that clear? The membrane is continuous structure. Now that red part that covers the organ is called visceral serous membrane. Generally, the word visceral refers to organs. And the blue part is parietal membrane. It covers the walls of the cavity. Does that make sense to you? Does that make sense? Okay. Now, why? And you may ask, hold on, what's here? Fluid. This serous fluid, okay? Serous fluid that prevents rubbing, prevents abrasion. We good so far? And how is it? Always ask yourself the question, why do we learn it? And if you're not sure, ask me, like, why is it relevant? Why is it relevant? Imagine that this is the heart. So this is visceral pericardium, and this is parietal pericardium. And there's fluid between them, and everything's good. But out of a sudden, as a result of some infection, your parietal or visceral pericardium become inflamed. Okay? Inflammation leads to accumulation of fluid, and you have more and more fluid in this cavity. And it starts squeezing your heart, and it's called cardiac tamponade, and your heart cannot normally pump blood, and you're in big trouble. Make sense? I know a person who had, it's called pericarditis, had pericarditis. Over the course of the disease, there's bacterial pericarditis. The doctors remove about 2 liters of that excessive fluid from his pericardial cavity. It's small. So it was bad. That make sense? Any questions on, and we're going to use visceral and parietal pericardium, not so much AP1, AP2, virtually every organ. Visceral parietal pleura, visceral parietal pericardium, visceral parietal peritoneum. Any questions? No? Okay. I'm going to do one thing. I'm going to pause that. All right, so we're going to talk about the levels of organization in human. I'm going to chat about some stem cells and types of tissue and stuff like that. Got it. Structured living. So levels of organization. We're not dealing with a chemical. So we always start with cell. Cells, various cells, and tissue. Okay? So for instance, well, not so much, various cells. But muscle cells form a muscle tissue. Neurons and glia form nervous tissue. Tissues, there are 4 types of tissues. They form organs. So each organ consists of multiple tissues, 3, 4 tissues, and each tissue has its own function. Organs, like parts, blood vessels form an organ system, cardiovascular system, and systems form organs. That make sense? So, like, how do you answer the question, is this an organ? Does it have a specific set of functions? Yes. Does it consist of multiple tissues? Yes. It's an organ. Okay? So, let's talk about types of tissues. There are 4 types of tissues. There is epithelial tissue. Okay? Which serves as a barrier. Maybe a little tricky. Basically, what I'm trying to say is that if you have a place where you have to separate a lumen from the tissue. Then you have epithelial tissue. Look at this. Skin, the surface layer, is epithelial tissue, okay? Because it's a barrier that separates everything else on the body from the environment. In your mouth is covered with epithelial tissue. It separates a lumen, like in your oral cavity, from the rest of the body. Look in your blood vessels, inside of the blood vessel, it's covered with epithelial tissue. It separates blood from everything else. Inside of your intestine, covered with epithelial tissue. It separates the lumen of it, whatever is inside of the intestine, from the rest of the body. Make sense? Epithelial tissue also forms glands. Okay? People sometimes say glandular tissue. It's not entirely correct. Glands are formed by epithelial tissue. Then you have connective tissue. So connective tissue connects and supports. Examples would be bones, ligaments, tendons, that makes sense? Then you have muscle tissue. Responsible for movement. And then we have nervous tissue. Basically, signal transmission. Communication. So it's, in a nutshell, 4 tissues. And you may be confused knowing this, that, some people say, oh, bone tissue, liver tissue. You can say, in this tissue, like here, we found, a parasitic wall. It just refers to that, we cut the organ open, and inside of the organ, not in the lumen, not in the mouth, not in the stomach, but in the organ, we found a wall. But strictly speaking, those are only 4 types of tissue, true types of tissue. Good? So obviously these types of tissue can be further divided in many subtypes, and we'll discuss them. But before we do this, I want to briefly outline the idea of embryonic development of tissues and the idea of the stem cells. So stem cells it all starts in a blastocyst with the totipotent stem cells. Totipotent stem cells. Toti means total, everything. Potent means potential. They have a potential to become any tissue in the human body, literally any tissue. These cells are said to be undifferentiated. Now, what does that mean, differentiation? During differentiation, cells become more specialized. So when totipotent stem cells differentiate, they become pluripotent stem cells. Pluripotent stem cells, which form 3 embryonic tissues. They form ectoderm, mesoderm, and endoderm. Ectoderm, essentially, if you look at embryo at this stage of development, it's quite literally layers of cells. The outermost layer is ectoderm. The innermost layer is endoderm, and in between is mesoderm. Do you follow me so far? Now, in humans, ectoderm gives rise to such organs, and you need to know this: skin and nerves, Okay? Mesoderm, as an example, results in the development of kidneys and muscles, while endoderm develops into the respiratory and digestive system, which kind of lines up with the position in the embryo. Okay? Awesome. Now, pluripotent means many, not all, but many. Okay? And then inside of each tissue like this, so this pluripotent stem cell differentiates, specialize further into multipotent stem cells. Multipotent stem cells, it means that they are even more specialized. They can differentiate in many other cells, but it's kind of limited. A good example is bone marrow stem cells. Okay, VMSC. Cells in your bone marrow can differentiate to produce red blood cells, or white blood cells, or platelets. But you see, all those cells, in one or another one, belong to blood. So there's multipotent bone marrow stem cells cannot give you cells of a bone or of a liver. Make sense? And even further, some cells can differentiate into unipotent stem cells. For instance, you have unipotent stem cells in the olfactory epithelium in your nose. When you expose your nose to various environmental conditions, cells that are responsible, neurons that are responsible for sensing smells, they die. It's a normal process. And those unipotent stem cells, they differentiate into these neurons. Now, cells that cannot differentiate, they're super specialized, they're completely specialized. Eventually, we call them terminally differentiated. Example of terminally differentiated cell is a fat cell, adipocell. That's it. It's done. That make sense? Red blood cells, terminally differentiated. So far, so good? Now, why should you learn that? You have heard about stem cell therapy. The idea is that you take embryo, human embryo, you can isolate pluripotent stem cells, and then based on the type that you can distinguish them, and based on the type that you isolate, you can direct them to develop into an organ. Sounds absolutely awesome, right? There are a couple of issues. There's an ethical issue, the embryo collection, which I do not want to touch with a 6-foot pole, so spare me. And then there is an issue with the rejection, because technically, genetically, the embryo and the potential donor have to be fairly close. Make sense? This is why scientists talk. And it was I'm always amazed how this idea is popping somebody's mind. Like, you have to really be a genius to just think of it and think that it's feasible. They thought, well, what if we take a differentiated cell, maybe not terminally differentiated, but pretty differentiated, like fibroblasts from the skin, and play a movie, The Amazing History of whatever, story of Benjamin Button on it, okay? And run it backwards. Differentiate the cell. Grow it up. And two scientists, I have names. They got Nobel Prize for it. They developed a method to basically de-differentiate the cells and produce what is called inducible pluripotent stem cells, iPSC. It's a pretty routine technique right now, at least in animals. It's fairly easy. You can take fibroblasts and run them backwards and produce pluripotent stem cells, and then try stem cell therapy on, let's say, mice. Okay. There are a few problems with the human Ipscs. One problem is kind of weird. So essentially, truly pluripotent stem cells, how old are they? A couple of weeks maybe? Because the embryo is a couple of weeks old. Turns out that inducible pluripotent stem cells, they aren't as good as original ones because they have that imprint of an actual age. Okay? So, issues, but scientists try to overcome it. As far as I know, there were no successful therapies with Ipscs. There are some experimental. For instance, in case of a stroke, cardiomyocytes, muscle cells, not stroke, myocardial infarction. When a person gets myocardial infarction, part of the heart dies. And one of the therapies is to kind of inject those stem cells to regrow the muscle tissue. Okay? That's pretty cool. And if, for instance, hypothetically, I would receive such a therapy, my own cells will be used to produce these cells. Therefore, the hypothetical organ that will be grown out of these cells will be immunologically mine. There will be no rejection issue. Does that make sense? Now let's talk about each individual tissue separately. We're going to start with epithelium. As I mentioned, it forms barriers and glands. And we're going to do a really nice breakdown. And I'm very clear which tissues you need to know. What I think we're going to do today, we will try to review all the tissues. And next Tuesday, we just dedicate our time to a lab. So you look at the tissues. You use microscopes, you're going to bring up slides, So it's going to be like more of an exercise thing. Good? And you have a background. So, epithelial tissue can be classified based on two categories. First is number of layers. If tissue has one layer of cells, it's a simple. If tissue has many layers of cells, it's called stratified. Okay? So far, you with me, right? And then there's another class, parallel classification, shape of the cell. If it's flat, it's squamous. If it is shaped more like a cube, it's a cuboidal. And if it's sort of elongated, like a column, it's called a columnar. And we can do the same classification here. There are a couple of tissues that stand sort of apart from this. One is transitional. One is pseudostratified columnar. And we're going to go back to this a bit closer to the end of this conversation. So I'm going to show you which ones you need to know, which one I will ask you about. It's not all. First of all, how you name tissues in this case. Simple, squamous. Simple, cuboidal. Stratified cuboidal. Make sense? Now, which ones you need to know? I'm going to just, so you need to know all simple epithelium. Now, simple squamous, a single layer, relatively flat cells, it's not a good barrier, right? Epithelium is a barrier, but this is not a good barrier, which is great. It means that this barrier is permeable, and it will be present. So sometimes you need a barrier that stuff can get across. That makes sense? So you will find it in the places where there's a lot of transport, diffusion or filtration. Your blood vessels are aligned on the inside with a simple squamous epithelium. Your capillaries in the kidney glomerulus, where filtration occurs, aligned with simple squamous epithelium. Alveoli in your lungs, where gas diffusion occurs, simple squamous epithelium. Cool? Simple cuboidal. I'm going to put filtration diffusion. Simple cuboidal. A lot of secretion. In fact, secretory activity. A lot of glands are formed by simple cuboidal epithelium. Okay. And in the kidneys, absorption. Columnar is basically the same, but think of it this way. If you have a cell that, and I'm kind of making up the sizes. If you have a cell that is this big, like wide, that's cuboidal, and this wide, that's columnar. This versus this. Which one represents the thicker barrier? This or this? The second one, right? The columnar one. So you're going to find columnar epithelium in the places where the environment is more aggressive, like your lungs, where there's a lot of crap coming, or your intestine, where there's even more crap coming. That makes sense? So columnar epithelium will also do a lot of secretion and absorption. But as I mentioned, it will be found in the places with more sort of aggressive environment. Respiratory tract, digestive tract. Cool? Now, what about stratified? The only stratified epithelium that I will ask you about is stratified squamous. Okay? So you have many layers, because stratified, of relatively flat cells. Why do you need many layers? So you can lose the outermost layer and replace it. Lose it and replace it. We good so far? Okay. What does that mean for us? Think about it. Every time we rub our skin, rub off a lot of cells, dead cells. Those cells are dead. And then will be replaced. So stratified squamous epithelium protects from friction. Friction, abrasion, places like your skin, obviously. The mouth and esophagus, a lot of abrasions going on here. Vagina, anus, a lot of abrasion goes in those places. Good? Skipping this. Transitional epithelium. You have pictures there. Transitional epithelium is several layers of cells that are kind of cuboidal-ish, squamous-ish. Transitional epithelium has a unique function, being able to stretch dramatically. Transitional epithelium is found in such stretchable organs as urethra, all urethra, distal urethra, ureters, and urinary bladder. Okay. Pseudostratified columnar is weird. So it's a columnar epithelium, columnar cells, but they are not perfectly shaped. So something like this. Okay, so essentially it's one layer, but turns out that the nuclei, they will be positioned differently. And what you see is something that looks like one layer of cells based on the nuclei appearance, and then another layer of cells. Does that make sense? This is why it's called pseudo-stratified. It looks like stratified, but it is not. Is that clear? Trachea, first and foremost. Trachea and bronchi. Secretes mucus. Okay? We're good. I promise. So we have, which is 6? Did I forget any? No, I don't think so. Oh, that's good. Yeah, so this 6 times. Okay? Can I kill it? Now, a couple more things about epithelium. First, it forms glands. And we're going to introduce, we're not going to talk about endocrine glands in this semester, but I just let you know that glands can be endocrine. So endocrine glands secrete outside. By outside doesn't necessarily mean outside of the body. It means outside of the tissue. So for instance, your sweat glands are, mixed it up. I wrote endocrine, I thought about exocrine. No, endocrine glands secrete in the blood. Apologize for it. They secrete in the blood, period. Okay? Thyroid gland, pancreas, pituitary, gonads, they all produce chemicals that are called hormones that secrete in the blood. Sorry. Good? And then you have exocrine glands. These ones secrete outside. What does that mean? Outside refers more to, not necessarily only to skin, although it is, it's outside. For instance, you have exocrine glands like pancreas. There is an exocrine portion of it that produces pancreatic juice that goes into the lumen, the empty space, in your intestine. Technically, it is outside. It's not your body. That hole is not your body. Does that make sense? So this is what exocrine means. Mammary glands, exocrine glands. Now, exocrine glands divided into 3 categories based on the type of secretion. They can secrete in a merocrine fashion, which means cell produces a nicely formed vesicles that contain whatever they secrete, and the cell remains intact. Apocrine, when a fragment of the cell gets separated from it, and everything that is in this fragment is released. Makes sense, right? So cell is a bit damaged. Then there's holocrine secretion, when individual cell bursts, releasing all its content. You got this? Now, another concept that is kind of related to epithelium is the concept of intercellular junctions. So, okay, junctions can be gap junctions. Now, gap junctions are usually not present in the epithelium. They're present in some types of muscle tissue, smooth muscles, and cardiac muscles. What they are ion channels between the cells. So the good example, I'm not going to turn my camera to myself, but imagine that this room is one cell, and imagine that this room is one cell and the hallway is another cell. This door will be a gap junction. If it's open, changes in one cell can be transmitted to another cell. Cells can communicate by ions floating from one cell to another. Does it make sense? Then there are tight junctions. As you can imagine, they're tight. So they make epithelial barrier very impervious. For example, blood vessels that go through your brain are lined with simple squamous epithelium on the inside. But you really don't want a lot of stuff to go from the blood into the brain unless it's basic nutrients and respiratory gases. So those epithelial cells are very tightly connected to each other by tight junctions. Does that make sense? They really super tight. This, okay? Nothing can get in between the cells. And then there are anchoring junctions. Basically, the idea is that they hold epithelial cells together. They aren't as tight. Okay? So there are junctions adherents, desmosomes, and hemidesmosomes. I'm not going to ask about this thing. Basically, know the difference between gap tight and anchoring junctions. So the main difference, junction adherents allow a bit of a stretch between epithelial cells. That makes sense? And desmosomes and hemidesmosomes just hold them together. Now, I really failed to address the important structural feature of epithelium and illustrated with desmosomes and hemidesmosomes. Let's draw an epithelium. I'm going to draw a simple cuboidal, which is, there's no much difference. So those are cuboidal cells, all right? And these are desmosomes, okay? They hold cells together. You know what I mean? Now, it looks a bit like a brick wall. So bricks are usually set on some kind of a foundation. Foundation in this case will be what is called the basement membrane. Okay? And it's a fundamental feature of all epithelial layers. They all have basement membrane underneath that they are attached to. Basically, basement membrane separates epithelium from underlying connective tissue. Am I clear? Now, why it's important to know? Well, first of all, transport here and here, transport via epithelium can be different. Hemidesmosomes, they're located here at the bottom. Okay. Now, in terms of language, we will use terms like apical side and basal side and lateral side. Generally speaking, in terms of the physiological properties, apical side is rather different from the basal and lateral side. Does that make sense? You good? And these differences we're going to encounter not so much, well, kind of we're going to see it kind of sort of in the integumentary system, but most differences will start to appear really critical in things like digestive and renal system. The regulation of transport from the apical and basolateral side, slightly. But even in the infectious disease sphere, which I'm a big fan of, for some viruses, the mechanisms by which they cross apical side and then basolateral side, they're different, and then explains the features of infection. Okay? So terminologically, does that make sense? So apical side faces the lumen, basolateral side faces the tissue. Got it? I'm going to ask you a simple question. Say it's a simple cuboidal epithelium. It's one cell thick. You see any blood vessels? There are none. Epithelium is the only tissue that is not vascularized. So there are no blood vessels in the epithelium, period. You may ask, and rightfully so ask, how the heck they receive oxygen? By diffusion. There are blood vessels in the connective tissue here, and oxygen and CO2 can freely diffuse through the tissue and nutrients as well. Yeah, they're fine. But epithelium is not vascularized. Any questions before we move on? Okay. Connective tissue. Oh, I love it. Connective tissue is really I will be royally annoying with my flowcharts, but in my opinion, when you draw it, it really structures the things extremely well. So let's do connective tissue. First, we're going to do the main elements of the connective tissue, okay? So there's matrix, or you can call it extracellular matrix. There are cells. What are the components of matrix? It's a ground substance. Ground substance are proteins, protoglycans, various long carbohydrate chains, basically a bunch of organic glue, okay? And there are fibers. As this word explains, those are fibers, and there are three types of them. It's collagen fibers that are responsible for mechanical resilience. Why it's important? The more collagen fibers you have in a particular tissue, the more mechanically resilient this tissue is. By the proportion of collagen fibers, you can basically tell how strong is the tissue. Elastic fibers, which give tissue an elasticity. More elastic fibers, more elastic tissues. And there are reticular fibers. Reticular fibers are interesting. They're found in only one tissue. They form a mesh, like a filtering mesh. That makes sense. They quite literally, they like coarsely filter this stuff. Good. Let's get to the cells. The cells will be fibroblasts. Fibroblasts are cells that produce matrix. Okay? Fibroblasts produce matrix. That's their function. There are mesenchymal cells. Those are stem cells that produce fibroblasts. Okay? And there are white blood cells. I'm not going to get into the details. There are macrophages, there are neutrophils, there are various lymphocytes in the connective tissue, okay? But white blood cells. White blood cells, as you may know, they protect against infections. Yes. Mesenchymal cells are stem cells that generate fibroblasts. Okay. Good so far? In some types of connective tissue, you're going to find adipocytes. That's fat cells. Again, it's fine. Adipocytes are derived from fibroblasts, but that's another answer. Does that layout make sense? And I deliberately put fibroblasts closer to the matrix, showcase that they produce matrix. So far, good, awesome. Now we're going to get rid of this. And we're going to classify. Now we know what the components are, and we can address the whole classification superlative. So connective tissue. Divided into two large groups, connective tissue proper and specialized. So the term proper doesn't mean like that it's improper. It just means that sort of these are classic sort of connective tissue, if you know what I mean. And these are a little bit more special. Although I would say that separation is a bit unjustified, I don't know. So proper connective tissue further can be divided into loose or dense. And that separation is pretty strict. It's based on the number of collagen fibers. Dense connective tissue is way more collagen than loose connective tissue. Does it make sense so far? Good? Loose connective tissue. There are three types. First is areolar. Areolar, now look how we form a full name. If you want to, like full name, loose, areolar, connective tissue proper. In reality, usually like two words, loose areolar, everybody understands. Dense regular. Good? Cushioning. Main function is cushioning. You can find loose areolar connective tissue surrounding most of the organs, providing cushioning, providing a place for immune cells to protect and stuff like that. Okay. Adipose. Plain and simple, flat. it's fine. Okay. Energy storage. Cushioning to some extent, but let's admit in humans, if we talk about what's considered, healthy, physiologically proper weight, adipose is not much of a cushioning, and it's not much of a flotation device, and it's not much of an insulation. It's not that thing. Okay? So adipose tissues, energy storage. And we have reticular loose connective tissue. Now here comes the mesh that I was talking about. So this reticular loose connective tissue is found in the lymph nodes, where lymph flows through and carries all the debris and dead cells and pathogens. And loose areolar connective tissue with a lot of loose reticular connective tissue with a lot of reticular fibers that form mesh. It filters out all that crap so your immune system can properly respond. Make sense? Dense connective tissue. Well, first one is, I want to mention is elastic. Quite obviously, you can stretch and you can. So now remember, this is not a muscle; it can contract. It's like just like a rubber. You stretch it, it recoils. So many walls of stretchable organs, particularly arteria, bronchi. Okay. Then it's got irregular. Now in dense, regular connective tissue, there are a lot of collagen fibers. And all these collagen fibers are oriented in the same direction. Does that make sense? So imagine that you are trying to suspend some heavy stuff from whatever, like a beam. One rope doesn't cut it, right? Many ropes will work. And you can keep loading and it will still be okay. Okay. Wait 1 second. Let me switch to the battery saver so at least I have some. Okay. So you have many ropes, right? Basically, you have many collagen fibers that are oriented in the same fashion. So one direction effort, these tissues will withstand with a great success. Talking about tendons or ligaments. Imagine a muscle that pulls on a tendon. Unidirectional pull, right? But if suddenly there is a force that acts in any other direction, these tissues become vulnerable. So tendons and ligaments are fairly easy to strain and rip away. Does that make sense? If the force is directed not in the right direction. Now, if there's regular, there should be irregular. This type of connective tissue can withstand forces, pulling forces in all different directions. Okay? So you will find this in structures that experience those pulling forces. For example, it will be things like joint capsules. Because when bones move, the forces are directed. Your skin, okay? Think of it this way. I can pull my skin in any direction and it doesn't care. Okay? Make sense? So these are 6 connective tissue problems. Now what about specialized? We have a cartilage, a bone, blood. Yes, blood is a connective tissue. It does connect. Right? There's matrix, which is plasma, and it has a lot of cells. white blood cells, red blood cells. So it's a very specialized connective tissue. Bone, look, I do not have to explain to you where you can find a bone, so that's done. Now, what about cartilage? There are three types of cartilage. Hyaline, elastic, and fibrous. Sometimes it is called a fibrocartilage. Where can you find these? So, let's start with the fibrous. Fibrous cartilage is characterized by very small cells of the cartilage, which are chondrocytes, okay? Specialized fibroblasts. So very small chondrocytes, massive amount of collagen. So it's very mechanically resilient. And it's specifically resilient against depression. So, intervertebral discs, menisci of the knee, and pubic symphysis. We're going to call Arnold with all this. Not Arnold, Benjamin. Arnold can be in there. So here, that's a pubic symphysis. Okay? You can say, what kind of pressure? Well, think of it this way. The weight of the trunk. I hope it's not going any further. Is pushing on the hip bones and they push on the symphysis. That makes sense? Elastic cartilage, some elastic fibers, three locations. 1, 2, and epiglottis, 3 right here. That's where you find elastic cartilage. And hyaline cartilage everywhere else. Intercostal cartilage, elastic. Okay? Not elastic, hyaline. All ends of the bone, hyaline cartilage. The part of your nasal septum that separates your nose into two nostrils, you can feel it right here, like this one, tip of the nose. This is hyaline cartilage as well. It has decent mechanical resilience and decent elasticity, kind of in between the two. Does this make sense? Okay. So we have, I think we're going to finish all the tissues today. We're going to do muscle, which is very short, and nervous, which is very short. So, muscle tissue. There are 3 types of muscles. Skeletal, cardiac, smooth. Skeletal muscle, those are muscles that we can train, basically. Biceps. So Arnold is a great illustration of our skeletal muscle. Okay? Cardiac muscle. One and only place, your heart. Smooth muscle. Walls of the hollow organs, which can do contraction. Blood vessels, lymphatic vessels to some extent, parts of the esophagus, stomach, intestine, entire intestine, bronchi, not all, some. Even your eyes have a lot of smooth muscle inside. Yeah? Now, let's talk about some differences between this thing. So, I'm not going to make a table, but can you control your skeletal muscle? Yes. So they are voluntarily controlled. Okay. What about your heart? Can you control your heart? No. So cardiac, we'll put it in the middle. Both cardiac and smooth are involuntarily controlled. Okay. Now, what about the speed of contraction? Can you contract your skeletal muscles fast? Look at the boxers. Oh yeah, that punch you won't have. So fast contraction, slower contraction, slow contraction. Make sense? Now, how can you stimulate your skeletal muscle? It turns out the only way that you can, stimulate your skeletal muscle is by nerve signal. So only nervous stimulation. And look, this makes perfect sense. Like, you may not think about it. Think about this. I have muscles, deep muscles in my arm that control my fingers like this. And I know that they will do a fist when I want it because I control them only through the nerves. But imagine if, in addition to nervous controls, imagine my skeletal muscle would be controlled by chemicals or hormones or even mechanical stimuli. Which means, say, I don't know, I take a sip of epinephrine, and all my skeletal muscles start to contract uncontrollably because I cannot control where epinephrine goes, right? So, exclusively nervous control allows skeletal muscles to be precise. Here, this chemical, hormonal, mechanical controls, we don't have a power with those, but we do not control. Those are involuntary, right? You have autonomic responses that are independent of your consciousness. That makes sense. And lastly, a few structural features. So skeletal muscle cells are straight, long, straight, cardiac are branched, and smooth are spindle shaped. Now this is not super relevant, but smooth muscle, skeletal muscles, multinucleated. Cardiac muscles, usually one nucleus, sometimes two. Smooth muscles, always one nucleus. Okay. And finally, it's not relevant yet because we're not going to talk about it too much. Striations. So these muscles are striated. If you look at the muscles, skeletal muscle or cardiac muscle, you will see little stripes. Striations reflect the internal structure of the cell and the contractile mechanisms. How exactly? And smooth muscles not striated. We will come back to it in Unit 6. It basically tells us so far. It provides us with an important clue how to recognize these muscles. And it also tells us that mechanism of contraction of skeletal and cardiac muscle, these mechanisms are very similar, but smooth muscle, that's different. So far? Good? Okay. Nerves. Two types of cells. Neurons and glial cells. Neurons are the ones that convey the message. Does that make sense? These are cells that actually perform that signal transmission, communication function. Glial cells, they are about maintaining neurons. So number-wise, glial cells outnumber neurons about 9 to 1. So 90% of cells in your brain are not neurons. I usually compare neurons to a rock band, like Guns N' Roses, and glial cells are to the stage group. I know that's always a bad example. Metallic is better because there are 4 people. Okay? There are 4 people in the band, but think of how many people are needed to move them, feed them, mount the stage, set the instruments, and so on and so forth. So glial cells is the road crew. Neurons are like running the group. Okay, that makes sense. Obviously, where can you find nervous tissue? Brain, spinal cord, nerves. Make sense? Any questions? So since our next big effort is to look over some microscopy, so what I plan for the next, let me pause it, the recording.